And let's go ahead and start with our first category, which is going to be fundamentals. All right, I'm gonna move my head. One second. Boop. Moving my head. We're gonna be right here. All right, so fundamentals for 200. Again, you don't have to wait for me to read the full question. Read it all the way through, answer to your best of your ability, say what is if you want the points. All right? Says the nurse is preparing to administer an oral medication to an infant. In which position should the nurse place the infant? Is it 1, prone, 2, semi-Fowlers, 3, Trendelenburgs, or 4, dorsal recumbent? Study strategy tip. I always say it every week. Whenever you have any type of practice question, especially for NCLEX, you want to read through the entire question, including the answer choices, one good time. All right, don't go too fast, but read through the question and the answer choices fully, and then go back and read that last line of the question just to remind yourself of what the question's actually asking you to answer. All right, in this case, it says, in which position should the nurse place the infant? We're about to administer an oral medication. So which position should we place that infant? All right, I'm seeing 2s, majority of 2s. I do see some 1s, but I see majority of 2s, which is semi-Fowlers, okay? Make sure you guys know why and the rationale behind why you chose your answer. We're gonna go through it, but I just wanna make sure you guys know why you chose what you chose. All right, so let's go ahead and see what that answer is. And the answer to fundamentals for 200 points is, drumroll please, what is 2? What is 2? Let me move my head. All right, what is 2? It says, what is 2 semi-Fowlers? The nurse should administer oral medications with the infant sitting in an upright position. Why? To prevent aspiration if the infant cries or resists. All right, semi-Fowlers is that upright position. Trendelenburg's position is on the back with the head lowered and prone on the abdomen. So it's like if they're on their back like this is their head, this is their feet. Their head is going to be lower than their feet. So they're kind of like at an angle. All right, now with that head being lower than your feet, if you try to give an infant or anybody some medicine, Trendelenburg, oral medication, Trendelenburg position, you are asking for a choking. you're asking for someone to choke. All right, aspiration, that's what you want to prevent. It says oral medications could not be administered to an infant in either of these positions. Dorsal recumbent means on the back and flat, so there would be a risk, of course, of aspiration with this position. Okay. High-Fowlers is actually the correct answer. High-Fowlers was not an answer choice, so semi-Fowlers was the answer for this specific question. All right, first person to get what is 2 and get it correct and answer first on my screen was future labor and delivery nurse. Great job. You answered first. Who's that? Future LD nurse. Hey, Lou. Congratulations. You are now on the scoreboard with 200 points, right? Yep, 200. All right, so future LD nurse. First of all, I love the manifesting that you have with your TikTok name. I love it. All right, great job. Now, if you did not answer first, but you still answered correctly, still give yourself a round of applause because, again, the NCLEX is not Jeopardy style. It's not group style to answer it. As long as you get the answer correct within the allotted amount of time, you're winning. You're definitely doing what you need to be doing. So getting this answer correct is a step in the right direction. If you did not get this correct, make sure you pay attention to this rationale. Screenshot it if you need to. That's the most important part of all the practice questions because it's like a little mini lesson at the same time. It's a refresher. All right, so let's move on to our next question. Our category is going to be do nutrition. Nutrition for 200. Really, this, yeah, sure. We can say nutrition. All right, moving my head. Okay, here we go. This is nutrition for 200. The nurse has a prescription to give 30 milliliters of an antacid to a client through a feeding tube. Which is the priority nursing action? 1. Assess tube placement. 2. Flush with 30 milliliters of sterile saline. 3. Aspirate to determine residual volume. Or 4. Administer the antacid by gravity flow. Remember what I said, read through the question and all the answer choices one good time, and then go back and reread that last line. We are looking for the priority nursing action. All right, and what do we know about that word priority? Okay, what is the priority nursing action? Now, please note that whenever we see that word priority in NCLEX style questions, you're more than likely going to have more than one correct answer, but you're looking for the most correct, okay? Whenever you think about priority and answering priority questions, you want to think about Maslow's hierarchy. You want to think about those ABCs, okay? And you also want to think about safety, client safety. All right, now let's look and see what you guys are saying. I'm seeing like a few different answers, but I'm seeing ones, I'm seeing some twos, I'm seeing some threes. All right, let's look and see what that correct answer is. You guys ready? Or you still need a couple seconds to answer? Get all your answers in, okay? All right, let's look and see what that answer is. Ready? We're looking for the priority nursing action. And nutrition for 200, the correct answer is, what is 1? Assess tube placement. Assess tube placement. Who got that one? A lot of you guys got that one. Great job. If you didn't get it, and I see a lot of people were kind of tied between like 2s and 3s, but the correct answer is 1, and we're going to go through why it's 1, all right? But let me go ahead and give my points. Give the points to the person that said what is 1 first. And correct on my screen. So that person is, wait for it, future LD nurse again. Great job. You're on the scoreboard with 200 points. So you just got another 200. So you, my love, you now have 400 points. Awesome job. Great job. Now remember, everyone else, just because you didn't answer it first didn't mean you didn't get it correct. Okay, so as long as you answered it correct, you're on the right track. All right, great job. Now, for those that chose 2, 3, or anything else, let's get into this rationale so you understand why the answer is what it is. It says, although each of the actions in the options is important, evaluation of tube placement is the priority. Why? To prevent aspiration and to ensure that medication delivery will be in the stomach. Okay, remember, whenever it comes to nursing interventions or nursing action, you always want to look at the assess option first. Okay, you always want to assess before you touch or do anything. Honestly, you want to assess and see what you're looking at, see what the situation is, and make sure that whatever it is you're about to do at least starts off in the right track. So you always want to assess first. That's a little hint. NCLEX test taking hint, assess first. You also learn that in like health assessment, okay? What are you guys saying? Not right, there we go. All right. You guys good? You ready? Add pie, thank you. I was like, what's that second one? All right, ready for the next question? Hold on. I'm trying to find. All right, let's just go to the next question. I can't move my face. All right, next question. Let's do, someone said something about mental health. So let's do a mental health question. Let's do mental health for, do I even have a mental health question? Let's actually do pediatrics. Let's do pediatrics for 300. Yeah. Let's do peds for 300. If it is cut off, like the first like letter or something is cut off, make sure that we're going to read it through. So if you need any assistance with what it says, just let me know. We're going to read it together. All right, so this is pediatrics for 300. A mother brings her child to the Well Child Clinic and expresses concern to the nurse because the child has been playing with another child diagnosed with hepatitis. The nurse prepares to perform an assessment on the child, knowing that which finding would be of least concern for hepatitis. Is it 1, jaundice, 2, hepatomegaly, 3, dark-colored frothy urine, or 4, left upper abdominal quadrant pain? All right, which finding would be of least concern for hepatitis? All right. What is hepatitis? After you answer, let me know. What is hepatitis? I literally cannot move my face. What is hepatitis? Oh my gosh, are you serious? All right, I'm gonna give you guys some time to answer. You always want to give yourself about a minute. I'm sorry if you cannot see me. Not going how I want it to go. All right, let's go ahead and see what you got. Yes, liver inflammation, inflammation of the liver. The hepat is the stuff, is the prefix for liver, and itis is inflammation. So let's see what that answer is. All right, which finding would be of least concern for inflammation of the liver? Let's go ahead and get into the answer. The answer to this one is, drumroll please, pediatrics for 300. And the answer is what is for. Who got that? Who got what is for? Great job. All right, let's rationale first. All right, let me scroll up and see who got what is for first. And that person is Tomi Lola. Tomi Lola, great job. Congratulations. I saw a lot of people were kind of between 1 and 3, but we're going to get into why the answer is what it's for. All right, Tomi Lola, you have those points. You now have 300 points, and you are right behind future labor and delivery nurse. You still have more questions and more points to win, but let's get into why the answer is what it's for. All right, remember, we are looking for the finding that is of least importance for a child with hepatitis. All right, so left upper abdominal quadrant pain, that is our answer. It says assessment findings in a child with hepatitis include right upper quadrant tenderness and hepatomegaly. Right upper quadrant tenderness and hepatomegaly, that's what's going to hint. And those are the findings that you're going to find in a child with hepatitis. So left upper abdominal quadrant pain, when we're looking for right upper quadrant pain, isn't going to be indicative of hepatitis. So that's why it is the least or is the least important. All right, it says the stools will be pale and clay colored, and urine will be dark and frothy. Jaundice may be present and will be best assessed in the sclera, nail beds, and mucous membranes. Okay, what is jaundice? If we're looking and assessing to see if a patient is jaundice, what color are we looking for? What are we looking out for? And depending on skin color, race, that may or may not show up in the actual skin. So that's why they said the best place to look would be the sclera, which is the whites of your eyes, nail beds, and mucous membranes. That's where you'll see any type of discoloration the clearest, no matter what color you are. Okay. Yes, so jaundice, you're looking for that yellow discoloration. Okay. Yellow, yellow, yellow. Great job, great job. Awesome job. All right, you guys, does that make sense? Liver's on the right. All right, you ready for the next question? Give me a thumbs up if you are ready for the next question. And let me know, do you guys like this type of review? Are you learning? Are you surprised that you're answering what you're answering? Are you surprised that you're getting them as correct as you're getting them? Don't sell yourself short, okay? Because you are that girl. You got into the nursing program for a reason. All right, so don't let it surprise you. All right? Okay, let's head and go to our next question. Let's do adult health, aka med-surg. Adult health, aka med-surg. Or guy. Sorry, Jay. My fault. But yes. Adult health for 400. I know there's male nurses, but majority of the male nurses are not my audience. All right. It says the nurse provided education about the tetanus toxoid and administered it to the client via injection after stepping on a nail while walking on the beach. Which statement by the client indicates successful teaching? Is it 1, the tetanus toxoid is caused by viruses? Is it 2, the tetanus toxoid is caused by parasites? Is it 3, the tetanus toxoid is an optional treatment, so I really don't have to have this? Or is it 4, the tetanus toxoid are toxins that have been altered so that they are no longer toxic? Which of these statements by the client would indicate successful teaching? Okay. Make sure you note how that last sentence is phrased, because you'll see that and you'll also see the opposite. All right. This one, we're looking for the statement that indicates successful teaching. But in other questions, you'll be looking for statements that indicate the need for further teaching. Okay. So basically, we're looking for the statement that is true, that lets us know that, okay, they got everything that I said, they fully comprehended, and now they're saying it back to me and in the correct way. So which one of these statements are true? I'm seeing lots of 4s, lots and lots of 4s. So either we all got it right or we all got it wrong. I say it all the time. So let's see if we are either going down or going up together. Okay, and the answer to this one, adult health for 400, is what is 4? Awesome job. What is 4? Great job. First person to get this correct and say what is on my screen is future labor and delivery nurse. Listen, you did not come to play. Okay? Your Wi-Fi, who you use for Wi-Fi? Because you are on it. All right, you already have 400 points. So you now want an additional 400 points. So you have a total of 800 points. All right, and then next we have Tammy Lola coming up second with 300 points. Again, we still have many more questions to win many more points. It can be anybody's game. It's still early. All right, now let's go ahead and get into the rationale. Again, the answer is what is 4. If you got what is 4, or if you got the 4th option, Great job. You understand what this question was asking. You understand this topic. Claps for you. It says toxoids are toxins produced by bacteria that have been altered so that they are no longer toxic. Their important antigenic receptor sites remain intact, enabling antibodies to the antigen-producing toxin to be produced. The remaining options are incorrect statements, so our correct answer, again, is what is 4. Okay? Great job. I literally think everyone got that. You want the question again? Hold on. Let me show you the question again. All right, that's the question. This is the question we just had. Somebody wanted it. Ashby wanted it really quick. I literally cannot. Oh, okay, got it. Yay, I'm back. All right, now screenshot this if you have to. Again, if you want to play the full 25 questions, if you want to play the full 25 questions, make sure you apply to join Camp Nursing School, campnursingschool.com, or you can go to the link in my bio for the link to Camp Nursing School. But that is our free online community. And that's where you can find not only all the replays, but the actual mobile version. So you can play on your phone, on any device, honestly, by yourself, anytime, anywhere, or with a group. And you'll have access to all 25 questions. You get 25 new questions every week, every Thursday. And you also get access to these replays as well for if you want to just go through the entire library. There's like over 50 at least. All right, so let's go ahead and get into the next topic. How you guys feeling? You guys doing okay? Give me a thumbs up if you're feeling good, feeling smart. All right, let's go ahead and change this topic. Let's do maternity. Maternity for 400. All right, maternity for 400. Move my face, put it right here. All right, it says, the nurse is collecting data during an admission assessment of a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks and tells the nurse that she does not have a history of any type of abortion or fetal demise. Using GTPAL, what should the nurse document in the client's chart? All right, is it option 1, G equals 3, T equals 2, P equals 0, A equals 0, L equals 1? Is it option 2, G equals 2, T equals 1, P equals 0, A equals 0, L equals 1? 3 is G equals 1, T equals 1, P equals 1, A equals 0, and L equals 1. And 4 is G equals 2, T equals 0, P equals 0, A equals 0, and L equals 1. So using GTPAL, what should the nurse document in the client's chart? Okay, everything that we need to know is in this question. All right, it's giving us a rundown of this client's maternal history. So that's what we're going to use to answer this GTPAL question. All right, make sure you guys know what GTPAL stands for. All right, after you answer, we're going to go through it. This is maternity for 400. All right, maternity for 400. All right, let me see what you guys are saying. I'm getting a little bit of everything. I'm getting 2s. I'm getting 3s. I'm getting 1s. Got a 4. Majority of everyone's saying 2 though, but I do have a few people saying like 2s and 3s. I meant 1s and 3s. So let's see what that answer is. Okay, well, first, let's write this down because we're going to have to refer to it later. All right, we know that the client is currently pregnant with twins. She has a healthy 5-year-old child who was delivered at 38 weeks, and no history of any type of abortion or fetal demise. Okay. So with us knowing that, let's look and see what that answer is. Ready? GT Pal. This is maternity for 400, and the correct answer is, drumroll please, what is 2? What is 2? All right, let's get into it. All right, remember what I said, the rationale is one of the most important parts. Okay, not only are you getting a first look at what these type of questions are going to ask you in the topics, but it's also giving you a rundown of not why the answer is the correct answer and why the other ones are not the correct answer. Okay, so GT Pal, the G equals gravidity, which is the number of pregnancies, the number of total pregnancies. The answer is what is 2, so that means that this G equals 2. All right, the number of pregnancies. We know that she had the healthy 5-year-old, so she was obviously pregnant once, and she's currently pregnant now. Okay, with twins, but she's currently pregnant now, so that's 2 pregnancies. That's 1, 2. 2 pregnancies. So G equals 2. That is correct. T is term births. All right. T equals term births. That's anything or any birth that was longer than 37 weeks. Giving birth after being pregnant for longer than 37 weeks. And the question that we had, in the information that was given to us in the question, the child was delivered at 38 weeks. All right, so that is a term birth. Remember, she's currently pregnant, so she's only given birth once, and that was a term birth. So T equals 1. All right, P. P as in Paul, that is preterm births. Okay, now that's before 37 weeks. All right, that P is 0 because, again, she's only had 1 birth. And that 1 birth was a term birth. She's been pregnant twice, but she's currently pregnant, so she's only given birth once. So that P for preterm is 0. She did not have a preterm labor. And then A is abortions or miscarriages. Okay, abortions or miscarriages. It's included in the gravida if before 20 weeks. And it's included in the parity number, aka the P, the number of births, if past 20 weeks. But remember, in the actual question, it said that she did not have any type of abortion or miscarriage, elective or natural, nothing like that. So A is 0. And then our L, which is the number of current living children, that L equals living, is going to be 1 because, again, we have 2 pregnancies. She's currently pregnant, so that leaves her with 1 birth. And that child, who is currently 5, is alive and well, hopefully. But yes, we're going to claim it. Alive and well. All right, so that equals, G equals 2 for the total number of pregnancies. T for term birth equals 1. P equals 0. There's no preterm births. A equals 0, no abortion or miscarriage. And L is going to equal 1 because that's the current number of living children that 5-year-old is currently just kicking. Okay. Now, something that's very important. Well, let me finish reading what this says. It says a woman who is pregnant with twins and has a child has a gravida of 2. Because the child was delivered at 38 weeks, the number of term births is 1 and the number of preterm births is 0. Number of abortions is 0 and the number of living children is 1. Now, please note this: when it comes to GT Pal and maternity, they will usually try to throw in like multiple births in there. So, for example, like twins. And where some people will get mixed up, and I just want to make sure you don't get mixed up, is that even though she is pregnant with twins, when she gives birth, that's going to well, the gravity is still one pregnancy. However, she's giving birth to 2 children. So just kind of make that little mental note and be aware of that, because a lot of people will kind of switch that and they'll think, oh, twins. So automatically put like either 2 pregnancies or one birth, but 2 children are coming out. So 2 births, 1 pregnancy when it comes to and twins. Same thing with triplets, any type of multiple birth situation. Okay. All right. First person to answer that correctly was future LD nurse. Man, what Wi-Fi are you on? So you have another 400 points added to your score. So you have a total of 1,200 points. Great job. Awesome job. Let me see what you guys are saying. I think someone said twins is +1 in gestation. Awesome. Awesome. All right. You guys ready to move on to the next question? Give me a thumbs up. Hold on. If she gave birth to twins, would T be 2 or 1? I always get. See, Sarah, I was just saying that. If she gave birth to twins, would T, aka term births, be 2 or 1? I don't remember if they told us how far along in her pregnancy she was, but that would depend on when she would actually give birth to those twins. If it was like 38 weeks as well, and it was actually a term birth, then that would be 2 births, but 1 pregnancy. All right. All right, now let's go ahead and get to the next question. All right. For those just now coming in, welcome to NCLEX Jeopardy. I am Nurse Sam, your host and creator and founder of NCLEX Jeopardy and thenursesam.com, where we make studying fun for nursing students, especially those who are visual learners and need more than just a boring, daunting textbook to learn and really retain that information. Okay? So we are doing our NCLEX Jeopardy. We just got finished doing maternity for 400 points. Now we're about to get into our next question, and that is going to be, let's do fundies. Let's do fundamentals for 300 because this is a very important topic. Honestly, no matter what stage of nursing school you're at, it doesn't matter if you're a new nursing student, graduating one, in the middle somewhere, doesn't matter. You need to know acid-base imbalance. Okay? Now, in camp nursing school, we had a whole week of acid-base imbalance. And there's a workbook. There's like a 2-hour-long group study session replay for you, all in camp nursing school. So if you want to kind of tighten up those skills, this plus others, make sure you check out and join campnursingschool.com. And of course, it is free for your consumption. All right. It says the nurse is caring for a client with several broken ribs. The client is most likely to experience what type of acid-base imbalance? Is it 1, respiratory acidosis from inadequate ventilation? 2, respiratory alkalosis from anxiety and hyperventilation? 3, metabolic acidosis from calcium loss due to broken bones? Or 4, metabolic alkalosis from taking analgesics containing base products? What is our answer? And then I'm going to ask y'all why. Then I'm going to ask you why. All right. What is our answer? So what do we know about this question? Break it down. Let's break it down like we do in NCLEX Arcade. Okay. What is the situation? We have a nurse that's caring for a client with several broken ribs. All right. What is the problem? Or the problem that we have to answer or solve? The client is most likely to experience what type of acid-base imbalance if they have several broken ribs? Okay, we have 4 acid-base imbalances, so it literally just has to be one of these. respiratory acidosis or alkalosis, and metabolic acidosis or alkalosis. In this type of question, we don't have values. So we don't have that pH level. We don't have CO2. We don't have the bicarb. We don't have those values. So we have to go based off of assessment findings. Assessments, that's what we have to go based off of. All right, now let's look and see what that answer is and see what you guys are saying. Remember, if you guys want those points, to say what is. All right, make sure you say what is and then 1, 2, 3, or 4, whatever, if you want those points. If you're here just for the fun review, free and fun review, have at it. Welcome. Please stay. Thank you so much for coming. You don't have to put what is. You can just answer. Okay, that's how I know who wants those points and is currently in nursing school, and who either has all those products because you love me so much and you are serious about nursing school and acing exams, but who has those already and doesn't need it. All right, so I'm seeing 2s and 1s, honestly. I'm seeing lots of 2s and 1s. Lots of 2s and 1s. All right, let's look and see what that answer is. Okay. I'm very interested to know, once we put up our answer, I'm very interested to know why and how you guys got the answer that you got, and what memory tricks do you use to remember which one's which? Like, how did you get to your answer? Okay. And the answer for this one is, drum roll please. What are we on? Is this fundamentals? It is. All right, and the answer is, wait for it, was 1, respiratory acidosis. Respiratory acidosis from inadequate ventilation. Do I have my thing? Yes, it's right here. All right, so respiratory acidosis is most often caused by hypoventilation. Okay, hypoventilation, inadequate ventilation. What do we know about our client? They have several broken ribs. Now, whether you've ever had broken ribs before, bruised ribs, whatever, you know that they're painful. And anything that's going to cause you pain, you're not really going to do too much of. Breathing is very painful when it comes to having broken ribs, bruised ribs. It's going to cause a lot of pain. So naturally, your body's going to want to avoid that pain by avoiding like deep breathing. So your ventilation and just that breathing process is not going to be optimal. It's not going to be adequate at all. It's going to be inadequate. Okay. Hypoventilation, below normal. It says, once again, the client with broken ribs will have difficulty breathing adequately and is at risk for hypoventilation and resultant respiratory acidosis. All right. Now, the other options, yes, are incorrect, but as far as talking about why we got the answer that we got, even if you didn't know that specifically, you know that anything having to deal with those lungs, okay, respiratory. All right. Any broken ribs, our ribs are cage for what? Our lungs. So our lungs are going to be most likely affected from broken ribs than metabolic, which is your kidneys. Okay, so we know that with that being said, anything that had metabolic in it, we could cross those off. So metabolic acidosis and alkalosis, we can eliminate those. So respiratory acidosis and respiratory alkalosis. That's where we kind of got to figure out which answer it is between the two. And the correct answer is respiratory acidosis. Why? All right, how did we get to the acidic or the acidosis versus the alkalosis? That hypoventilation. What do we breathe when we breathe in or breathe, period? What's happening with oxygen and carbon dioxide? Specifically, when we are breathing in, we're breathing in that good old O2, good old oxygen, and we're breathing out CO2. All right, carbon dioxide. Oh no, my head. Yes, carbon dioxide. Now, if we are not ventilating correctly or adequately, and our breathing is actually slowed, our breathing rate is lowered, slowed, we're actually keeping a lot of that CO2 that's supposed to be expelling out, that we're supposed to be exhaling out, that's building up in our body and in our blood. And that buildup of CO2 is what's going to cause our blood pH levels to become acidic. So that's how we get respiratory acidosis. Make sense? Okay. Does that make sense? Correct. All right. I gave those points, right? 300? Let me look. I did not give those points. Let's look and see who got was one first. And I believe I already looked, and it was definitely future LD nurse. Future labor and delivery nurse. You are just on it. Let me tell you something. As far as being first. 1,500 points on the scoreboard now for you. Great job. Tammy Lola, we still have you for 300 points as well. Everyone else, if you're not on the scoreboard, but you're getting these answers correct, clap for yourself. Celebrate your wins, okay? This is just as helpful as any other practice exam that you would do, but we're just doing it in a fun way and on TikTok. Like, two things just combined to make it awesome. All right, so you guys ready for the next question? Remember, acid-base imbalances are very important, especially if you are going into your first semester or even a med-surg. Make sure you know ins and outs of acid-base imbalance. If you need more additional help on that, make sure you check out campnursingschool.com for free resources in that supportive group study environment. It's a free online community for nursing students. So make sure you check that out for all the resources and help you need. All right, so now let's get into, what time is it? Our last question. Okay, yeah, our last question. Let's get into it. And we are going to do, wait for it. Adult health or med-surg for 100 points. What was the site you said for more info? campnursingschool.com. campnursingschool.com. You can go also, it's also in my bio, but I'm going to message it as well. Put it in the comments as well. But let's go ahead and get through our this question. I saw someone asking about like fluids, so perfect. This says a client is admitted to a hospital with a diagnosis of DKA or diabetic ketoacidosis. The initial blood glucose level is 950. A continuous intravenous infusion of short-acting insulin is initiated, along with rehydration with normal saline. Normal saline is usually 0.9% sodium chloride, okay? The serum glucose level is now decreased to 240 milligrams per deciliter. The nurse would next prepare to administer which medication? Is it 1, an ampule of 50% dextrose, 2, NPH insulin subcutaneously, 3, IV fluids containing dextrose, or 4, phenytoin for the prevention of seizures? All right. The nurse would next prepare to administer which medication? Let's look at our situation. We have a client that was diagnosed with DKA or diabetic ketoacidosis. Okay. What do we know about DKA? All right. We know that that blood sugar is high. All right. Super high. The initial, and their blood is acidic. The initial blood glucose level was 950, and then it was brought down to 240. All right, so a continuous IV infusion of short-acting insulin was initiated, along with that IV rehydration with normal saline. All right, so we brought that blood sugar down, we rehydrated. What would be the next step? Medication-wise, which medication will we be prepared to administer next? I'm seeing you guys say, what am I saying? I'm saying twos and threes. I'm saying just 2, 3, 2, 3, 2. 2 says NPH insulin subcutaneously, and 3 says IV fluids containing dextrose. Let's see what that answer is. Oh, tell me, while I'm getting that answer, tell me why you got the answer that you got. If you got 2, why did you get 2? What made you come to that conclusion? And be honest. If you just say you were guessing, just say that. Girl, I do not know. I was guessing and hoping for the best, because that's real. Sometimes that's just what it is. You're never going to know all questions. Okay? But if you do know, tell us why you got that answer. Not just because we're playing this, but honestly, on the actual NGN, they have these types of questions that are like, they're twofold. And they basically say, what is the answer to this? And then tell us why. So it's like a drop down. It's like, the answer is this because of this rationale. So make sure you know your whys. Let's get into what this correct answer is. All right, and adult health for 100. The correct answer is, drum roll please. What is 3? What is 3? IV fluids containing dextrose. IV fluids containing dextrose. All right, let's look into the rationale behind why it was 3. Okay, let me look and see what you guys are saying. Well, first, let me see who got this answer correct first. Really quick, Queen Shay, if you're still here, you said, how can I see a schedule for these reviews? They're every Thursday at 7 p.m. here on TikTok. Boom. If you want to really get reminded, again, sign up for Camp Nursing School. You'll get the reminders. You'll get the access to the full 25 questions every week, as well as the replays. All right, campnursingschool.com. First person to say what is 3 is, wait for it, Ivy. Stunna Ivy. Great job. You just bullied your way onto the scoreboard. Awesome job. All right, Stunna Ivy, you are now on the scoreboard with 100 points. Congrats. Everyone else that got 3, great job. If you didn't get 3 and you said 2, let's get into why the answer is not 2 and why it's actually 3. All right, so it says emergency management of DKA focuses on correcting fluid and electrolyte imbalances and normalizing the serum glucose level. If the corrections occur too quickly, all right, serious consequences, including hypoglycemia, which is when your blood sugar drops too low, and cerebral edema, swelling of your brain, those things can occur. Now, during management of DKA, when the blood glucose level falls to 250 to 300 milligrams per deciliter, the IV infusion rate is reduced. All right, that IV isn't flowing as fast, especially because we already fallen into this range. We're going to reduce that rate of the IV, and a dextrose solution is added to maintain a blood glucose level of about 250 milligrams, or until the client recovers from ketosis. 50% dextrose is used to treat hypoglycemia. NPH insulin, which is what acting? NPH insulin is what acting insulin? Answer that really quick. NPH is what kind of acting insulin? With speed, with rate, okay? It says NPH insulin is not used to treat DKA. Phenytoin is not a usual treatment measure for DKA. Phenytoin, Dilantin, you usually don't see that for DKA. It's said to prevent seizures, but there was nothing in this case study or in this case that told us anything about the possibility of having a seizure. So that wouldn't be, we're not just going to attach that to this question and to their treatment plan. It's not usually a treatment or a measure. Okay. So let me see what y'all are saying. Wait, let me see. Right. NPH is intermediate. NPH is intermediate. Want a hint? NPH is intermediate. That's how I remember it. Anything long acting starts with an L. Lantus, Levemir. I forgot the third one, but it starts with an L. Yes, those are long acting. Lantus, Levemir equals long acting. They start with L. Intermediate acting insulin, you're NPH. Okay. What else are you guys saying? Oh, good job, Brittany. Brittany not only said intermediate, but she also told you that it's cloudy, okay? Which you'll need to know when you're trying to figure out what insulins to mix, clear versus cloudy. So yes, NPH is cloudy. All right. Awesome. Thanks. I'm glad you like that little tip. How do you mix the insulins? Clear before cloudy. It's like I always say when you're describing how to mix insulins, it sounds like a Weather Channel report. Like, oh, we're going to have clear over cloudy, clear before cloudy. It's giving the Weather Channel, but insulin, the insulin channel, if you will. All right. Okay, so, oh yes, and as far as that clear before cloudy, clear is regular insulin and cloudy is intermediate or NPH. All right. I actually made a post about that on my Instagram. So if you want to see that, make sure you check out my Instagram as well. Let me see if I can put it on here a little later. All right. So let me see if we had any. You guys want one more question? Let me know if you guys got one more question. If you have time for one more question. Give me a thumbs up if you want to do one more question. Give me a thumbs up if you want to do one more question. Okay. Let's do pharmacology for 500. Let's do pharmacology for 500 for our last question. Just kind of end it with a bang, okay? It says, a client is prescribed tranylcypromine. The nurse educating a client about tranylcypromine should instruct the client to avoid which activity? 1, drinking any amount of wine. That sucks. 2, consuming any fresh dairy products. That also sucks. 3, exposing the skin of the face to sunlight. Or 4, eating either fresh or frozen green leafy vegetables. Okay, we're educating our client about the prescribed tranylcypromine. What do we know about tranylcypromine? What kind of medication is that? What is that? All right, what do we know about that? And what should the client avoid while taking tranylcypromine? Is it drinking any amount of wine? Remember to say what is if you want the points, or just answer if at this point we don't care. 2 is consuming any fresh dairy products. Okay. 3 is exposing the skin of the face to sunlight. And 4 is eating either fresh or frozen green leafy vegetables. Okay. Now, based on these choices, these answer choices right here, you can well, I won't say that yet, actually. I won't say that yet. I'll say that when we get to the rationale. But let me see what you guys are saying. I'm saying 1s and 3s. 1s and 3s majority. So half of you guys are saying 1, which is drinking any amount of wine. And the other half is saying 3, which is exposing the skin of the face to sunlight. Photosensitivity. Avoiding alcohol. or photosensitivity and exposing, avoid sun exposure. Why did you get the answer that you got? What kind of medication is tranylcypromine? Answer that for me as we get into the rationale. What kind of medication is tranylcypromine? Tranylcypromine. It's an antidepressant, but do you know what kind of antidepressant? MAO. Okay, let's go to the answer, to the rationale. All right. And the answer to this that will help end our debate between whether it's one or three. The correct answer is, drumroll please. That's a sucky drum roll. I'm so sorry. All right. The answer is, what is one? Drinking any amount of wine. So great job to you guys that A, said one, and B, knew what kind of medication tranylcypromine was. Or at least if you didn't know, you deduced it in some type of way. Yes, it's an antidepressant, but specifically it is an MAOI, or a monoamine oxidase inhibitor, MAOI. All right, and that's, again, used to treat depression. When it comes to pharmacology and MAOIs, if you see pharmacology and MAOI and it's telling you what not to do, this is like the top must-know thing to know about this type of antidepressants. Okay, it says food and fluids containing tyramine, such as aged cheese, smoked or pickled meats or poultry, fermented meat, beer, wine, and liquors should not be used concurrently or at the same time with MAOIs. Why? Because they can cause a sudden and severe hypertensive reaction. All right? And those are life-threatening. All right? That hypertensive crisis due to the mixing of that MAOI and foods containing tyramine, no, that's a tip that I want to let you guys know. Whenever you see MAOI, automatically in your brain, you should know, avoid tyramine. Avoid tyramine when taking MAOIs. Now, here's a little bonus question, or just a little comprehension quiz. MAOIs, if someone's taking MAOIs, for example, let's say this client right here, in what time frame should she avoid any foods and fluids containing tyramine? She cannot have any food and fluids, or he or she cannot have any food and fluids containing tyramine in what time period, or what amount of time? How long? There's a couple things that I want to clarify for you guys from me doing NCLEX Jeopardy and literally helping tens of thousands of nursing students pass their NCLEX and their exams. I'm going to give you an extra layer to it. 2 weeks, 14 days. All right. MAOI inhibitors. Anyone taking that needs to steer clear of foods and fluids containing tyramine for really avoid entirely, absolutely. But specifically within those 2 weeks, they can't have those foods, or it really, honestly, another type of medication as well that will, or anything that will counteract with the MAOI. Okay, so 14 weeks, let that stick in your brain, because you will get questions, and it's asking you, and it's giving you a time frame saying like, oh, you've been on it for a week, or the client's been on it for a week. What can't they take? So that's why I say make sure you know that time frame, 14 days, 2 weeks, very important. Now, as far as the foods and fluids containing tyramine, you also need to know, it's very important that you know examples and what kinds of foods and fluids contain tyramine. Here it's giving you like a good little overview. So it says aged cheese. Let's pause that really quick. Give me an example of an aged cheese. I remember many specific questions where they give you a specific type of cheese as if you were just a cheese connoisseur and knew it. But give me an example of an aged cheese. Blue cheese, absolutely. You mean an aged cheese. All right, and this is important to know because aged cheeses contain tyramine, but cheeses that have like a lower amount of moisture, they don't contain tyramine. They contain a low amount of tyramine. So I've seen questions where they're, like I said, listing those cheeses and saying which one, should you like definitely steer clear of, or which one is acceptable, or which of these meals is an acceptable meal for someone taking MAOIs. It's important to know. Parmesan, cheddar, brie. Awesome. Yes, absolutely. But cheddar, blue cheese, Parmesan, those are like the three main ones as far as what's an aged cheese, which you'll see. Now, the ones that are safe as far as tyramine contain a low amount of tyramine, mozzarella and ricotta. Ricotta cheese, mozzarella cheese, I think cream cheese as well, but definitely ricotta cheese and mozzarella. Those are low tyramine containing cheeses. So just know your aged cheeses and your safe cheeses as far as tyramine. Also, smoked or pickled meats or poultry. All right, so pepperoni. All right, fermented meat. Beer, wine, liquors. That's why I said any amount of wine. So basically, anybody taking an MAOI needs to stay clear of a charcuterie board. Anything that you would find on a charcuterie board, steer clear, because it's going to contain tyramine. All right? They should rename charcuterie boards with tyramine. Honestly. That includes chocolate. I don't see that on here. But yes, chocolate is another food that contains tyramine and should be avoided. So yes, when you're thinking about foods and fluids that contain tyramine, think about a charcuterie board, okay? It's gonna give you sliced cheeses, aged meats like pepperoni and salami. You're gonna have a glass of wine, a good Malbec, a nice red to bring out that blue cheese, all that. That's going to contain tyramine. You want to avoid that when taking MAOIs. All right? The more you know. You're welcome. I'm telling you, when y'all see this again, please send me a message saying, dang, Sam, you was right. I did get a question about this, or I did have to know about this. Thank you so much. I'll appreciate my thanks in the form of you acing and passing your exams, okay? All right. So, even overripe fruit, that's a good, absolutely. All right, so this was the last question. Who got this one? Hold on. Let's see. Who got this one correct? J. Andrea was the first person to say what is one. Make sure. So Freckled Bay, absolutely. Great job. You now have 500 points. Girl, if future LD nurse didn't have, just the best Wi-Fi in the world, you would have came in at the end and just kind of swooped up and landed in second place. Great job. Awesome. But future LD nurse, you have the highest amount of points with 1,500. You're ending with 1,500. Are you still here? Tammy Lola had 300 points. Like I said, Jay Andrea had 500, and Stena Ivy had 100 points. Great job. Congratulations to everyone that made it on the scoreboard. And a super congratulations to future LD nurse for winning. I feel like you've won before, but I'm not sure. I'm not sure. Where are you? Are you still here, future LD nurse? If so, do you have the Ultimate Nursing School Bundle 2.0 and or the study gummies, the bottle of study gummies, which, by the way, is selling out? We're most likely to be sold out by this weekend. I'm not joking. That's not even a marketing thing. That's not even me trying to just like bait you, clickbait you. We're gonna sell out by the weekend. And it's gonna take us another 3 months to get a fresh batch. So do not get got and do not miss this. Do not miss out on these study gummies, because I'm telling you, y'all gonna be in my inbox every day like last time saying, hey, when's the study gummies restocking? I'm telling you now, it won't restock again until probably closer to the summertime, because it takes about 3 months to cultivate those fresh lion's mane mushrooms, which is the key ingredient, which helps us really focus and concentrate. And it's a natural cognitive enhancer. So if you don't have your bottles of study gummies, we have the girlies over here ordering 10, 9, 10, 12 bottles at one time, because they already know they are not going to get caught slipping. So listen, thenurseam.com, go to the link in my bio and check out those lion's mane study gummies. All right? You do not want to start this new semester without something to help you, something natural to help you. Stay focused, increase your concentration, and help jog your memory so you can retain more and be able to recall it later and faster when you need it during exams, okay? So, great job. Let me go all the way down. Order mine today. Wait, hold on. Let me see are you still here? I don't think Labor Delivery, are you still here or no? Because if not, it goes to the second place winner, who is J. Andrea. J. Andrea, do you have the Ultimate Nursing School Bundle and or the study gummies? I have the worst Wi-Fi. That's okay. As long as you were answering correctly, look, the answering first and in Jeopardy style was just so that it can be fun and not overwhelming. Add a little friendly competition to it. It really makes learning and engaging with the material much better. You enjoy it way more. And because you enjoy it way more, you retain more of it. Okay? Let's okay. Let me look and see what you guys are saying. I'm gonna tell you guys about the study gummies in just a second. Let me make sure. And you don't have either one. Are you in school, J. Andrea? Are you in school? Are you in nursing school, or maybe taking your pre-nursing requisites? Because you are the winner. And so you are going to get that free prize for getting the most amount of points. Oh, you just graduated. Congratulations. Okay, perfect. So I'm gonna send you that NCLEX bundle, okay? Not only am I going to send you a free Ultimate Nursing School Bundle 2.0. That's our 400 plus page bestseller. It is digital and printable. Okay, you can use it on any device, whether that's your phone, whether that's an iPad or a tablet, your computer. Instant access, forever access. You also have complimentary updates whenever we send updates as well. And you'll be able to professionally print it or print it DIY if you wanted just a few pages, but the flexibility of that bundle is amazing. So you're gonna get a free Ultimate Nursing School Bundle and a free NCLEX Arcade, which is, if you love this fun review, this NCLEX Jeopardy fun review, you're gonna love NCLEX Arcade. And just like the name says, it is a review. This is our fun NCLEX review. And we're doing it like escape room, but it's escape room from very known, very popular video games. Like, instead of Super Mario, it's Super Cardio inside NCLEX Arcade. Like, it's things like that. That's just, it makes it fun, it's creative. And again, the engagement and the interaction really helps with learning and retaining all that information. All right, it's over 18 hours of video review. Plus, it comes with all the answers, all the questions and answers that we're going to be going through in the videos. You'll have a workbook version of it, and that's about 370 something pages as well. So not only are you getting the NCLEX content simplified for all my visual learners, but you're also getting the practice questions as well, so you can apply that content in the form of NCLEX Arcade. All right, and I'm also gonna send in a free bottle of study gummies. Since we're selling out right here, this is really what you guys need, and I'm gonna go right into that. So Andrea, let me find you. Send me actually I'm gonna do it to you. Okay, I am going to write that down. I'm going to send you a DM so I can get your information, so I can send over your digital products, the NCLEX Arcade and the Ultimate Nursing School bundle, as well as ship off that free bottle of study gummies. Okay, for everyone else, we do this every Thursday at 7 p.m. You will have another opportunity to win points, and whoever has the highest amount of points at the end is going to also win a free prize. Okay, so if you didn't win this week, you have next week, the week after that as well. Okay, so again, congratulations, Andrea, and I will be sending you that message. Okay. All right, now for everyone that was asking about the study gummies, we are probably more than that by this point. We're between 80 and 90% sold out of our entire restock. And we restocked like 2 weeks ago, a little over 2 weeks ago, and we're almost out again. So our Lion's Mane study gummies, let me pull that out for you guys. All right, these right here. These are our focus gummies. Basically, that's what I like to call them. They help support focus, mental clarity, give you that motivation, that steady motivation to complete whatever task that you're putting off for whatever reason, no motivation to do it, whatever the reason is. This decreases the need for, well, I won't say that. But this increases your cognitive performance, helps you with your memory, focus, and concentration. Okay, it also decreases test anxiety. That's what I was trying to say. It decreases test anxiety. All right, there is no caffeine in there, and it still gives you that boost of energy, boost of natural energy, without that midday crash or those really uncomfortable jitters. I personally have not traded, but I put down my Adderall, and I'll pick this up, 2 of these. I'll pick 2 of these up over my Adderall any day. Any day. I still get that same amount of focus, but I'm not up for 3 days and my appetite isn't curbed, and I don't have those shakes and dry mouth. All those sucky side effects of Adderall, we don't get that with study gummies, but you still get that same amount of focus. And that's due to the lion's mane that's in there, the L-theanine, the L-tyrosine, and the vitamin C. Okay? They're vegan, no soy, no GMO. They're made with pectin, not gelatin. And you're supposed to take like 2 a day. You can take it every day. 1 bottle is going to be 1 month if you take it 2 a day. But I have people that take it as needed. So before they go to work, or before they start a study session, before they do their laundry. And I have non-nurses taking it so they can get through their work day. All right, so no matter what it is that you're doing, if you need an increase of focus and concentration to get it done, this is what you want to get. All right. Again, we are about 80 to 90% sold out of our current stock. So if you want to grab that before the new semester starts, I highly, highly, highly recommend that you do that. So we're not sold out by the time you're ready. Okay. So I'm just trying to warn you. I'm just trying to give it to you. All right. Now, if you guys, do you have a bundle with every nursing subject? The Ultimate Nursing School bundle is going to be what you want to, going to be your best bet. We go through everything from fundamentals, farm to mental health, pediatrics, maternity. It's over 400 pages, critical care, over 400 pages of all that important, comprehensive study notes made for visual learners. So it's very colorful, lots of images, and it's usually themed in a fun way to make it more engaging and interesting. All right, like our IV therapy is Beyonce themed, right? Fundamentals is like Rugrats themed. Things like that. It just makes it more fun to learn and study. All right. For the rest of you, I just got my woohoo. Awesome, awesome. For the rest of you that were here and you joined me tonight for NCLEX Jeopardy, thank you guys so much for joining me. I hope you learned something. I hope you enjoyed it. Did you guys enjoy it? Give me your feedback. Did you love it? Did you like it? Was this a fun review for you? Was this helpful? Did you learn a lot? Are you coming to the next game? Are you coming next week to try to play and win? It's a great review, especially as we start this new semester. It is a great way to have fun while studying so you retain more. It's those same practice questions that you would get in whatever review book. Not the same, but I mean the same style. But it's in a fun Jeopardy style way. Okay, so make sure you guys tune in every Thursday at 7 p.m. Eastern Standard Time right here on my TikTok Live. That's at the Nurse Sam 1. There is no underscore period in any of my my names, my usernames. Make sure you follow me on that other app. Follow me over there at the Nurse Sam for more nursing school study tips and fun study advice and practice. Okay? Again, if you want to play the whole 25 questions, we only played about like 8, 9, or 10. If you want to play the entire 25 questions, make sure you join campnursingschool.com. That's where you're going to have your mobile version so you can play on any device, as well as the replays of this one and all the other ones from the past. Okay? I got the 10 thing. I had everything. No, the 2.0 is the ultimate. That's just the updated version. We updated that for the next generation NCLEX. So it's all that same information, but more information added, honestly. So the Ultimate Nursing School Bundle 2.0 is the correct bundle that you're looking for. All right. All right, guys. I will see you guys next week. Same time, same place, for another round of NCLEX Jeopardy with Nurse Sam. And I will see you guys then. Have a great afternoon. Well, night. It's night. Have a great night. I'll see y'all next week.